Hello, everyone. I hope you're out there. I can't tell who's out there, but we're going to start anyway. And welcome. This is the next edition to our series of webinars, informative webinars, to help educate our patients and anybody else that's out there on services that we offer or just on medical issues and aesthetic issues. So happy hour. Cheers. Cheers to everyone. I'm Dr. Susan Murrmann. I'm one of the partners and founders of the Murrmann Center for Wellness and Health 360. And I'll explain a little more about what 360 is in a minute, but I just want to tell you that we have all completed fellowships or I've completed a fellowship in anti-aging and functional medicine. My partners, have completed training in the same anti-aging and functional medicine as well. I'm very interested in peptide therapy. I've been certified in that. I've also been certified in fasting, nutrition, and longevity, which is very important, and it has a lot of applications in what we're going to be talking about today. So can we flip the slide again? I just want to tell you about what individualized health experience is 360 in our clinic. We have Dr. Heather Donato and Dr. Murrmann McDaniel. We're all three partners in the clinic. Like I said, we've all studied anti-aging and functional medicine. We believe in taking care of the entire patient, not just doing GYN exams and pap smears. We feel it's a 360-degree approach to our individuals that includes total body wellness, a personal experience to make a positive difference in patients' lives. And it's my pleasure to introduce Robbie McDaniel. She's an advanced nurse injector that we've had in our clinic, and she is amazing. I fell in love with her the first time I met her. She's very experienced, 13 years of experience in medical aesthetics and ocular plastics. She believes that expertise and personalized attention leads to focus on being the best you through a combination of her injection techniques as well as skin care, lasers, chemical peels, and tightening devices. So we're thrilled that she's here, and we're very fortunate we got to both attend an advanced injectable cadaver course in Nashville. It was an all-day long course where they actually dissected cadavers and showed us places the fillers can go and how we can enhance and make you look a lot better, and where the fillers go and what's not to do and what complications are. So it was a very informative meeting and course. And so anyway, I'd like to introduce Robbie McDaniel.
Thank you so much. I appreciate that, Dr. Murrmann. I'm so grateful to be here. I'm grateful to be able to speak tonight and also to be a part of this program at Murrmann 360. I'm very, very excited to be here.
Well, how'd you get started?
Well, in the whole aesthetic field, back when I was just a teenager, I had cystic acne and really wanted my skin to look better. I was on Accutane and all of the medications you did for acne back then. And I was in a number of pageants to put myself through nursing school. So I decided I was going to go to a place that way back then was called Janelle International Skin Correction Center. And Jerry O'Neill, who was before her time, decided that nutrition would heal your skin and create better skin and reduce your acne. So as a child, I went to these places to get these facials, and it was called actually layering, and they used a plant-derived enzyme to do that. And my skin became like porcelain. So I decided one day, I told my mom, I'm going to own one of these places one day, and I did. So I became the owner, did that for a while, and then it just evolved from there. Worked in dermatology for several years, directly with the dermatologist, and then also on their aesthetic side, and went through all my training to learn how to do injectables and facial rejuvenation with chemical peels and lasers.
Well, that's interesting that you say that, because the nutrition part we totally believe that there's a nutrition part
Absolutely.
to everything that we're doing and what we're doing here at the clinic. And we'll get more into that a little bit later on, but it's really, it really is the basis of how we're looking and we're feeling in our own bodies. And when it comes down to treatments, especially when we start talking about regenerative medicine. So just can you briefly go over what we've got in our clinic on the aesthetic side?
Right. Well, we have, of course, our Botox and our dermal fillers. We have chemical peels. We have a new peel called PRX-T33, which is new to our country, and we have it here. It's a wonderful peel that doesn't peel. So hopefully people will come to ask more about that. We also have laser procedures such as laser genesis, laser hair reduction. We also have Fraxel, which will rejuvenate the skin in 2 different wavelengths, deep and above. So we can treat acne scars. We can also treat melasma. We also have microneedling with radiofrequency. Just microneedling on its own. We have different chemical peels and facials. Also, we have aqua golds and dermasweep, dermablade. We have everything to address the skin's needs. We also, it's Tara and myself are the injectors here. Also, we have Anne and Jenny and Ginger, who are estheticians who address skin needs, skin care. Also, they're over the body sculpting and contouring center.
Yeah. Well, that's all great because that all feeds into what we're going to be talking about today when it comes down to regenerative medicine. So a lot of people go, what the heck is regenerative medicine? It's science meets aesthetics. So I think that's all very cool. And most people, when you hear regenerative medicine, you think of, oh my God, we're regenerating body parts. We've all seen a picture of a mouse with a new ear because they've stimulated growth or they printed it. Well, we're not that advanced yet. But what we're doing is what I like to call using you, yourself, to make a better you. And so it's applications in aesthetics and in GYN are just pretty amazing. It's harnessing and managing your own body's natural potential to repair, restore, rejuvenate, or what I like to call prejuvenate, because prejuvenation is something that we should have been doing a long time ago. That means rejuvenating your skin now, so we're not going to be facing all the problems that we've had down the road, such as caused by sun damage and stress and sort of like that. So is it buzzword or it's science? It's both. But there's lots of excitement and there's new applications, and we're going to be talking about that in just a little bit. So I want to know, what kind of regenerative medicine treatments do we have on our aesthetic side?
Okay, we have PRP, which is platelet-rich plasma. We have stem cells derived from fats. We have combination treatments such as microneedling with radiofrequency. We can also do microneedling with radiofrequency and adding PRP, which enhances the treatment. We use peptides, and we also have a particular diet that's really popular with us called the Prolon diet that helps stimulate our stem cell growth, which I guess you will probably elaborate that.
Yeah, I'll talk about that just a little later. But I want to know, when we're talking about regenerative medicine, what exactly does it do for us? What's the goal in aesthetics?
Okay, so with PRP or regenerative medicine in the aesthetic field, we're trying to produce what's called Neoproligenesis, and that is stimulating the body to produce its own collagen. We lose that over time with lack of hormones, hereditary, things like environmental factors such as the sun, yes, and just the weather, gravity, stress in our lives can cause us to have lose our collagen, which makes our skin
Not happy.
Yeah, not happy. Yeah, the sun it totally will take away. It destroys the collagen underneath. also causes, skin cancer, causes the skin cells to become flat, and they lay flat, causes skin laxity and tired looking skin. So we use PRP, but it's not a standalone treatment. We have to use a combination of things. Not PRP helps stimulate collagen growth, but we also want to include diets. That's what I always ask all my patients. They'll ask, well, how long does this collagen last? Well, what do you do for your skin? Do you take care of it? Do you put sunscreen on? Do you eat healthy? What kind of diet do you have? Are you drinking plenty of water? That all comes into factor of whether, we're going to stimulate and then also keep that collagen. So there's a lot of talk about stem cells. So what stem cells are significant? What's the significant in them?
Well, stem cells are pretty amazing. And I know everybody's probably heard of stem cells before, because what we're doing is we all have stem cells, but most people know stem cells that come from bone marrow. And bone marrow has been researched, and people look at your bone marrow stem cells. They're using bone marrow stem cells for transplant for cancer therapies. So there's a lot going on with bone marrow, but we have the largest abundance of stem cells in our own fat. And so that's a bigger resource for fat. Stem cells are the body's raw materials that serve as a repair system for our body. So stem cells are good, but with age, stress, and everything else, a lot of cells become senescent, which means they're silent. They're just hanging around, doing absolutely nothing. But unfortunately, they can influence other cells to do the same thing. And that's not good for disease states. Cancer has been related to that. So there's also a lot of buzz right now with senescent senolytics, which are drugs that they're creating to purge the body of their senescent cells, because senescent cells are just not good for you, not good for anybody, and they contribute to aging and diseases that are related with aging. But what if we could use our own stem cells to influence our skin or influence other parts of the body? And I think that's where it's really, really fascinating. Bone marrow is okay, but fat, of course, is easier to harvest, especially this here in the South. We might have a lot more fat and more stem cells, but they're really good. But we can purify them down for lots of purposes. So, but getting back to PRP, I want to talk about PRP just a little bit. What exactly is PRP? Because I know it can be used with stem cells and with fat.
Correct. PRP, like I'd mentioned before, is platelet-rich plasma. Plasma is a component, one of the components of whole blood. And by spinning it, we can draw out the plasma to inject in different areas. It's been used for years in orthopedics,
Wound healing. Yeah.
Yes. And now we're using it for cosmetic reasons, to inject under the eyes, to stimulate your own collagen, to stimulate stem cell growth, to give us back our natural youth and beauty rather than just filling with fillers. We can use them in combination to not just plump up a face, but actually stimulate your own cells to create your own natural beauty.
So like instant gratification.
Right. So a lot of people have heard of the vampire facial, which that's injecting the PRP back into the skin. We can do it a number of ways by doing it alone with just injecting it in different places in the face, under the eye especially, which is great for tear troughs. We're getting not so much, we can use filler, we can use it in combination with PRP. Sometimes we can use PRP alone under the eyes to give that bright fullness that we used to have that we've lost over time. Vampire facials, we're injecting that back into the skin to create collagen synthesis. We're so impressed with it that we are members of the Cellular Medicine Association, which was founded by Dr. Charles Reynolds. And so he was the inventor of the vampire facial. So there's so many things that we can do with PRP, and to make our own body stimulate and become beautiful without having to do just fillers and things like that.
No, I think that's all great. And now, PRP has its applications in the GYN side. To mention Dr. Runnels, he a brilliant man that's kind of he invented the vampire facelift, vampire facials, and all sorts of things. But he also invented the O-shot. And the O-shot is using your own blood again in the PRP fashion, but injecting it into your vaginal area or on the outside area. And it's shown to have some benefit with enhanced orgasm or with incontinence. Again, I totally believe that in this particular area, that you need to have a combination of procedures. I think it works great with Thermevo, which is our radiofrequency device used for what we call vaginal rejuvenation, but it's also has so many different benefits in increasing blood flow and increasing the nerve density in these areas. It's great for menopausal symptoms, but if you combine PRP with an actual, in the O-shot formation with the Thermeva, I think it works brilliantly. And not to mention, when we're looking at incontinence, it really helps. But Lycan sclerosis, which is a horrible disease that a lot of women will have in various forms, either from very mild to very severe, but injecting PRP into those areas in combination with radiofrequency greatly improves it. I don't think you're going to get a total cure from that. And it may be it's diet related as well. Mm-hmm. I try to counsel people on diet and what they're eating and what's going on with it. But that in combination, I think works great. Vulvodynia, which is a pain area that you can't touch the vulvar area because there's a lot of pain involved. They've been showing some good results with that. And also, which I think is very interesting and underdiagnosed in a lot of women, is pedental neuropathy. And that is where you can touch them and they don't feel pain, but they are feeling the pain continuously, especially if they cross their legs. They're feeling pain down there. And that's usually a problem with the pudendal nerve as well. And we've had great success with Thermeva with that, the radiofrequency treatment. And we've also had good success in the combination treatment of injecting PRP into that pudendal nerve and combining it with Thermeva, the radiofrequency. Because that can be a devastating thing for a lot of patients, just like Lycan sclerosis. So now let's get back to the aesthetic side. Let's find out what are we doing on the aesthetic side with PRP.
Okay, well, with PRP, like I said before, skin rejuvenation, fine lines and wrinkles, skin texture, acne scars, and we also are doing hair rejuvenation with PRP in combination with other things such as the vitamin supplements, Nutrafol, and a laser or Synetics laser, which stimulates the scalp to reduce inflammation and wake up those skin cells that are dead and produce more hair. We also are using it with fillers and adipose fats, which is stem cells, to help stimulate that collagen, stimulate new growth in the skin, your own natural beauty. And also combining PRP with our energy-based lasers, such as microneedling with radiofrequency, and then our aquagold. And what about stem cells from fats?
That's really a fascinating subject, because there's a lot of different types of fat cells that are stem cells that are derived from fat. First of all, like I think I said already, maybe Judy, my nurse, and I that do liposuction, we call fat liquid gold because it really is. I mean, we think about it in every form. I mean, it all comes out pretty. I tell people, no matter what color you are on the outside, your inside looks the same. It's beautiful yellow fat. But that fat can be harvested and you can get stem cells from that fat. So three different types of fat. First, there's the large format fat, which is derived from a minimally invasive procedure like liposuction. And when we wash it in its state and get large amounts, we can use that for gluteal enhancement or breast enhancement, but you have to have a lot of fat. There's also what we call microfat, and that's taking the fat and working it to it's a little more pliable, just like you're using a filler.
Smells
And
like butter.
just like butter, and putting it into the face as a filler. And then there's nano fat, which is taking that fat and filtering it and working it so many times that I guess it's more like clarified butter. It's more like what you dip the lobster
That's
in,
right.
So, and it's really good, but that fat, the nano fat, is pretty fascinating because that is stem cells and it's re-injected in minute quantities into your face and can rejuvenate your skin, which I think is great. You've seen some great results there. Now that's not used as a filler. It's used to rejuvenate your skin. So what do we do with stem cells in the aesthetic word, besides what I just mentioned?
Okay. Facial rejuvenation in the face, décolletage. It can be used in conjunction with facial fillers. So then you get your instant gratification with the filler, but then also you're getting that slow release of those stem cells that are going to create that collagen to give you that natural beauty that you had before in your skin when it was younger. We also are using it in butts and breast enhancements. So can you tell us more about that?
Well, like I said, you need a large quantity of fat if you're going to enhance it. But what we do also is in combination with fat injection to the gluteal area. What we're doing is 360 degree lipo sculpting of that area, which gives the butt its gluteal area more of its shape, and then injecting fat to enhance that area. And the same with the breast, although a lot of times we say when we do liposuction of the abdomen, it gives you breast enhancement anyway, because you don't have the fat that's in the way of your breasts. But it's very interesting. I've done several women who their vulvar area is deflated, and we've injected fat into that. That's another way of fat enhancements. But like we always talk, one size does not fit all. Everybody is totally individualized when it comes to what we need to do for their body, or what their needs are, what their areas of concern are. So we value in combination treatments. So tell me some of the combination treatments we do over on the other side.
We do PRP mixed with the hyaluronic acid. Like I said before, gives you that instant gratification and plumpness that you want, but then you've got your slow release. We can also do it as a standalone. I do a lot of that for people who don't quite have deep tear troughs, but they just need a little bit of brightness under there. It's become a little bit flat. They'll get an initial plumping from the PRP, but the body absorbs it. It's very safe. It's your own body product. So there's not a chance of any type of reaction or anything like that, because you're injecting your own body products, your own blood into your system. So also with hair restoration, we in that procedure, we will spin your blood. Like I said, the procedure is very easy. You just we draw the blood just like you would if you were having a lab test done, and we spin it, get the plasma out, and then we inject it into the skin, whether it's in your face, décolletage, or in the scalp. And then we sit you under the Synetics laser, which is red light therapy that helps stimulate and wake up those skin cells and hair follicles and decrease inflammation to help to stimulate the hair growth. Also in combination with the vitamin supplements, like we said before. PRP also mixed with the stem cells for
fat.
Yeah.
Then you call yourself fat head.
That's right. That's right. So, and there is a lot of studies done on that, injecting the fat into the nano fat with the stem cells into the scalp also will produce hair growth. PRP with microneedling, like we said before, we can do it a standalone of injecting it. A lot of times what I do on my patients is I will do microneedling with radiofrequency. It's like a sponge. You've got a lot of little holes in your skin. So I take that PRP and it just drinks it right in, and I apply it. Anything left over, they have taken it home and will put it on their face themselves within the next 2 hours. Some of them were kind of creeped out at the fact that they're putting their own blood on their face and they can't stand it. So I will go in and with a cannula, go under the eye or any areas that are of concern and inject that PRP. You okay? You okay? Okay. So also with threading, we do threading here. So the PDO threads are made of the products that are like in Micro Sutures, also in Sculptra. Those are biostimulators that will produce collagen. They do dissolve, but they also stimulate collagen growth. And an actual pool. We can also put PRP in some of the some of the threads that actually have a cannula where we can inject we
just had Botox for a second.
Sorry.
We were frozen in time. Did they hear that?
I don't know if y'all hear me.
Yeah, they heard it.
Okay, good.
Don't know if you heard that or could see it, but I'm definitely continuing to talk. And we can actually put the PRP through those cannulas into the threads, and as they dissolve, you're getting a stimulated collagen growth. And yeah. What about red light
Yeah, I was going
therapy?
to say, I
Tell
want
me
to
about
explain
red
that
light. Yeah,
because people
so-
think it's magic. Or they don't know what's
That's
going
right,
on.
yeah.
I can't feel it. I can see it. There's no heat. So are we really getting any benefits from red light therapy? What's really interesting, because I started getting involved with red light therapy because we purchased a red light therapy device for the vagina, actually called VFit, which has red light therapy. It has heat and it has stimulation, and is proven to enhance the tissue that it's touching or it's coming in contact with. So red light therapy, I just started doing a lot of research on that because I thought it was fascinating. Red light therapy penetrates the skin to the cellular level. And because of this wavelength, it enhances the cells and produces like a mild inflammation, but the mild inflammation actually is good because that produces healing. And when it starts producing healing, it starts repairing and promoting neoproligenesis. So it was so fascinating. I actually went out and bought a red light mask off of Amazon to see if it worked. But, it's something, the VFit we use 3 times a week, but it does really help with vaginal rejuvenation and incontinence. So now they've also been looking at it for hair. And you've seen people advertising, we can get the laser hair cap. It's not really a laser, it's red light therapy. So we've seen this a lot in magazines. I mean, you can get on the airplane and find it in one of those magazines and buy them duty free or something like that. So it's pretty fascinating, but we actually have the professional hair laser. So if you're doing the hair restoration and using the red light therapy with it, and then actually doing the Nutrafol, which is the hair growth, it's a win-win combination. I really think we've seen some good results with RF microneedling in the scalp and PRP and the hair. That's a picture of the hair laser on the left. It's pretty fascinating. And of course, there's Nutrafol, which I think is really, really great.
Yeah, the Nutrafol is a great product for hair growth. It contains your multivitamins that you need every day, but it also has the ashwagandha.
Yeah, ashwagandha. Yeah, that's it.
Root. I can never say that word, but that does decrease the stress. It's a stress adaptogen, so it does decrease stress, which stress can be one of the factors that leads to hair loss. Oh, yeah. Also, it has the curcumin in it. I think that's how you say it, which is the derivative of turmeric, same thing, which also helps with decreased inflammation. Right. So, and I have had people on Nutrafol alone that have had problems with their scalp and losing hair from autoimmune diseases, say that they actually have decreased irritation in their scalp just from taking Nutrafol.
Oh, yeah.
So with the combination of that, we can get really, really good results.
Good. So we mentioned peptides before.
Yes.
Peptides and nutrition. So, I'm certified in peptides, and peptides are, they're sort of a buzzword, but they're actually based on science too, because they're just short chain amino acids. And short chain amino acids, a lot of times, are precursors to other events in our body. We prescribe a lot of precursors to growth hormone and precursors to help losing weight, and like some of the peptides that we prescribe. They're all injection usually, but collagen is a peptide, and people underestimate collagen. And collagen is a supplement. Of course, we lose collagen as we get older, but we need to add collagen to our diets because that's real important in all these procedures. So if you're spending all your money doing all these procedures on something, you want to get the maximum benefit out of it. So collagen is really important. Also, the amino acids that are used to make collagen. So if you're taking certain amino acids and taking collagen, and then if you look at the chart, when you go to accelerate the production of collagen, PRP and hyaluronic acid are two things that just accelerate that and get that to a better point. So the combination of all that is very, very important. And just like nutrition and diet, I mean, that's really, really important.
It's what I tell my patients who come in and they're seeking, facial rejuvenation, skin rejuvenation, and they're wanting Botox fillers, all the really pretty fun stuff that we do. But I always go back to, what are you doing at home? What's your skincare regimen? What are you using on your face? What is your diet? Because if you come in here and you're spending this money and all this time and effort to get your skin where you want it and looking nice and glowy, it's kind of like going to the gym. You go to the gym, you work out, you're working your butt off. But what do? Do you go by and stop by,
potato chips,
fast food, and get some fast food? You go home and you feed your body something good, because it all works together. Same thing with your skin. Got to be feeding your skin something good with products, and also what you put inside your body, and good hydration.
That's great. And so diet too, we have a diet, and I hate to say the word diet because diet's like everybody goes, oh, I don't want to diet. But
a meal plan.
I like that. We have a meal plan, and it's scientifically based. And actually it has a lot to do with what we talked about today. It's called Prolon, the fasting mimicking diet. And it's 20 plus years of science of honing it down into what we can eat for 5 days a month that mimic you doing a water fasting diet, which no one wants to drink water for 5 days. So I'm not going to do that. But it gives you food, but there's calorie restriction. And I believe doing intermittent fasting with that as well, because, fasting has been around for thousands of years. And I think it's part of all sorts of cultures. But it's interesting how when your body has the stress of calorie restriction or fasting, what's happening is at the cellular level. Remember those silent, bad senescent cells I was talking about? Well, it helps purge your body of those senescent cells. And it stimulates your own stem cells to grow. So not only are we doing stem cells from the inside, or doing stem cells from the outside. So it makes sense to follow this type of diet and actually enhance your cells at the same time. Like if you're going to do PRP, after you're done with this 5 days, do the PRP, because that's going to set your PRP or your fat stem cells on fire and give you a better result. So I think that is just important. And I believe in intermittent fasting. I think that really works for weight loss. And of course, putting all the inflammatory foods in your body is not good, like gluten and lots of sugar. That and soy and sometimes dairy can be have an adverse effect. But anyway, that's kind of what you're seeing, what we're doing, which is this 360 approach to making you feel better on the inside, making you look better on the outside, and doing that for the rest of your life. It's all about longevity.
Well, what I like to think of us as not just you're coming here and you're getting something and then leaving. Okay, I'm finished. The 360 program is all the time. We're always here for whatever need you need. And so it's an ongoing process. So we're kind of like coaches.
Yeah,
You come in,
you're right.
and let's readjust this. Okay, that's working for you. Great. This isn't working for you. Let's adjust it. You know, same thing with skin. You know, you never stop. It's never ending. You always have to stimulate. You always have to keep going. You have to keep growing. You can never stop. So
That's all true.
Yeah, I like to look at it like that.
Yeah.
So we are always here.
Yeah. That's great. And so that kind of wraps up our webinar for tonight. And just a couple things to remind you of. It's our 25th anniversary coming up in November. I think it's November 2nd. Is that what we're doing, November 2nd? Yeah, it's November 2nd. And we're doing a big party here at the office where there's going to be lots of giveaways, discounts, a lot of vendors here with free samples of things. And most important, food and cocktails.
Yeah.
You want to hear that, but it's going to be a lot of fun. Last time we had one of these, it was, I think we had 400 people here. It was great. So please join us on November 2nd. We also have specials coming up with our 25th anniversary. We have Botox specials that are with $10 Botox units with Tara and Robbie on nurse injectors, which are going to be good. I'm going to book before September 30th, but we're probably going to extend that only because we're doing, we have our anniversary coming up. So it's 25 years of McDonald Murrmann. I always say Mary McDonald and I, she's the longest relationship I've ever had. But we're still together. How about that? And there she is. And thank you, and call for a free consultation
Consultations are free. Yes. Anything you have to
for whatever it
ask
is.
or whatever.
Yeah. And here we go with our wine. This is our group here. We've got Dan and Rolla, and we have Natalie, our nurse practitioner, and Shelly, our brains of the operation here. But cheers, and hope to see you soon.
That was good.
That was very good.
Very natural. Y'all did a great
I know it got easier and easier.
Yeah.